So welcome. It's always hard to do the session right after lunch because everybody's, and so we'll probably have more folks come in. And as Mary said, this is a discussion, so feel free to ask questions because this really is for you. The three of us could talk all day, and we might, so you might have to stop us. But I'm Kim Stevens. I am the Executive Director of the Muenzer MPS Research and Treatment Center. So I'm now working in academia, but before that I was the chair or president of Project Alive. Do you want to briefly introduce yourself?
You said briefly. So.
Oh, just, you can't, oh yeah.
We all get along well. I'm Mark Dant. I'm the volunteer executive director of the Ryan Foundation. It's an organization we founded the year our son Ryan, our only child, was diagnosed with MPS 1 in 1992. So it's been a long, long journey. I'm also the former board chair of the Every Life Foundation for Rare Diseases, Washington, D.C. based.
Hi everyone, I'm Kristin McKay. I'm the Executive Director of Project Alive. We are a Hunter syndrome research and advocacy organization, also a mom and sister to boys with Hunter syndrome.
So that's what we all have in common. We're all in the MPS space, and there are several organizations that were in the sort of Hunter syndrome, MPS 1, MPS 3, and so really we came up with this topic because even like at events like this, we start to see a lot of people working against each other, right? That are not working together in the same disease group. And so we thought, you know, we really get along well. I mean, we hang out outside of events like this, and we're thinking, can others do that? And not necessarily where you have to be best friends with someone, but how can you cooperatively work together on a shared goal? And so that's really what we want to share with you a little bit today. Things you can take away, implement in your own disease area. Think about how can you be the bridge, maybe with some other organizations in your disease area, how you can work more closely with broader organizations like Every Life, like Global Genes, like NORD, in a cooperative way. Because, you know, for us, when we talk about this all the time, you know, the central mission for us is saving kids' lives, right? That's what brings us together. That's what we're all doing. And every day, I know it, for me, I tell myself, and working now at a center where I'm working with all the MPSs, and where I'm also working with all the different groups now, it's really feeling like my role to be that sort of bridge to all those, but always coming back to this is my central mission, right? To save kids' lives. If it doesn't come to that, making sure that my ego doesn't get in the way, making sure that I'm not putting roadblocks up for others, and making sure that I don't feel like I have to get the credit for everything. And I think that drives a lot of sort of things, and we lose focus on what our central mission is. So I'm going to ask our panelists, Kristin, what did you see in sort of the Hunter syndrome space, or MPS 2, and then maybe in the broader space of how organizations are working together?
Yes, I think when I first really got involved into the different foundations, learned about them, came around and heard of everything, there were many different Hunter syndrome foundations all over the United States. And sometimes it was, you weren't quite sure of who was doing what, and that was a little bit confusing as just a parent. But then you start to learn and start to pick up on that. And what we have seen in our community is that eventually there comes a time when there might be one group that has a different connection to get closer to the goal that everyone shared, and the other groups start to realize that, and they say, hey, why don't we put our dollars together, make a bigger impact, and see what we can do with that. And what's really wonderful is if you're in the group that's receiving those funds or receiving that opportunity or invite to collaborate, when you're open to it, we have been able to see so many great things come from that. And I think the big piece is making sure that you still allow the other groups to have a voice and making it equal. That's something that is really important, because anyone who has had a foundation, if you raised $10 or $10,000 or $10 million, it really mattered to you. You had your heart in it. You took the time to start that. Many of us are community members of whatever disease space that we're in. And for those people that might work for an organization and they aren't a community member, there's still that heart and drive that kept you here in the first place, right? And so really recognizing that and understanding that someone's heart went into this and allowing them to have a voice in that process, but also recognizing that everyone has a different opinion. I think for Project Alive, many times we will see other groups that maybe they have a larger focus in the Northeast or Texas or whatever the location may be, and maybe they have a better connection to certain members of the community that I might not know as well. So perhaps they're hearing things about community needs or challenges that I'm not hearing. Well, I want to hear that. I want to learn about that. So bringing them to the table and being able to share ideas, collaborate, and also as our community has changed with new treatments and new options, taking the time to have us all stop and sit down and reassess and say, okay, what are the new needs? We have to all adapt to the community. Let's have everyone get together and talk about that and share what's important to them so that together we can prioritize and find those ways where we can collaborate and avoid working against each other in any way.
Yeah, I think those are excellent points too. And I think about, when I came into the Hunter syndrome space, when my son was diagnosed at 2.5, and I looked around and I was like, I need to do something, right? That was kind of you need that after a diagnosis, something you need to filter and so I really took an assessment of the landscape, and I was thinking, and there were 5 organizations working in this area, and then a broader organization working for all the MPSs, and I thought, I don't know which one to pick. Which one do I pick? And so that was really hard for me to sort of think about that. And the advice, I remember I went back to one of the leading doctors and I said, which organization should I back? And because you just need to pick your horse and go with it. And I thought, well, that's not what I like to do. I don't want to do that. And I thought it was very strange that they were all these organizations competing against each other. And so when I came into Project Alive, my first goal was to say to all the other organizations, we're all in common. We all are working towards a cure and treatment for MPS II. And that's what we share. And whatever infighting has happened in the past, I don't want to hear about it. We're starting from right now. Whatever happened back there, we're not doing it. And we're going to cooperate. And some came along, some it took a couple of years, but then they realized, she's really sincere about this. She's not just coming in and taking the leadership role. And I love what you said about making sure everyone has a voice, whether it's $10 or $100,000, and thinking too, and if you're thinking towards a broader goal, everyone's bringing something, right? And if you have $100,000, it's much more impactful then someone else might have, in 100,000, someone else might have 10,000, but you can collaborate and bring that together. You're going to have more of an impact and be able to do things. And Mark, you've been in this space a long time, and I think when you first came in, when Ryan was diagnosed, there wasn't a lot out there for MPS I. So how do you feel like you sort of set the tone, and then how did you sort of view others coming into the space that you had sort of created?
So here's a history lesson. Ryan was diagnosed in 1991, I mentioned that. We were told at diagnosis that his disease would take his life by the end of the decade. I remember kind of grilling the diagnosing physician in Dallas. Well, Dr. Weber, you say he's going to die, how do you know? Those are the obvious questions we would all ask, right? But then I asked him a couple other questions. Where are the pharmaceutical companies that make drugs? Because that's what they do. There are drugs for this rare disease. I've never heard the term. And he said, well, there aren't any pharmaceutical companies and there never will be, because your son's disease is so rare. There's not a business model built that can return on the investment of millions of dollars for a disease with so few in the US or in the world. Then I said, where are the scientists? And he said, well, there are very few scientists. So where do you go from there? What you look for is partners. Partnerships. Just what you both mentioned. That was 30 years ago. But what we needed in Dallas were partners. I knew no one else with MPS. No one else's child would I ever meet, I thought, with MPS. Now, I did find there was a national organization, a great organization for family support to help them. But the perspective at that time was, and my wife's mom actually called the national organization at the time, and she was told, well, you just basically, paraphrasing, but the reality was, she was told, your grandson's going to die. You have to start dealing with that. Well, that wasn't the perspective we wanted to hear at all, because Ryan was not going to die. Have we all said that? I think we have. So if we focus on that, he or she is not going to die. What is more important than that? Infighting? Who gets the credit for all the great things that will come? We needed partners. We didn't know of any. We did find a scientist. We found community to help us fundraise. But we still didn't find any other organizations other than the National Society, who at that time, again, was focused on family support. So where do you go? What do? You do it yourself until others come. And after the success of actually helping fund a treatment for MPS 1, that today, next month, the 10 families that were in that trial back at UCLA started in 1998. It's 25 years ago. Those 10 families are going to Northern California next month to celebrate the drug that started everything off. But it wasn't just the Ryan Foundation that started it off. It was other parents who realized, with the onset of the internet, because these are the dark days before the internet, that mom and dad can get empowered if they really believe that they can make a difference. And it was our goal to understand that maybe if it's not time for Ryan, even if we don't help the science move forward to find a treatment for Ryan, we will change the next generation. And if all of us on a route to find a treatment, to find our tomorrows, can focus on that one thing, we will change the next generation's life. I promise you, you will.
Yeah, and I think working together, when you talk about those partnerships, can you talk a little bit more about how you establish those partnerships and who specifically are those partners that you look for in the space, and can they be a bridge across organizations as well?
So we talk about partnerships in the nonprofit space. Vitally important, because all the moms and dads, like my wife and I, laying on the floor next to Ryan's bed, listening to him sleep every night, everyone else who's just been diagnosed is doing the exact same thing, because there is no hope until you stand up and find it. So how did we find partners? Well, first we needed a partner in science. Scientists need partners as well, but let's be frank, scientists oftentimes have their goal is to be published. That's not the scientist you want. You want the scientist who will be published, whose goal is to treat. So we found that in Emil Kakis, who now the CEO of Ultragenics. So we found science, but we also need a partner in industry. And so BioMarin was formed to take the drug that treated Ryan across the finish line. And then they needed a partner because the FDA called for a second trial, and they didn't have any funds because brand new company. So they partnered with a company called Genzyme, another partnership. And then we needed a partner in the FDA to understand the science does work. It took 5 years, but it did work. Today, thanks to the internet, and thanks to moms and dads realizing that they can make a difference, there are partners you can find if you look at them as a partner, not a competitor. And that's what Kristin mentioned, and Kim as well. Your partner in the disease groups, the National MPS Society, now funds hundreds of thousands of dollars in research for all the 12 different types of MPSs. That's what we need is hope. Hope is found in effort, and effort can be combined with others who are really focusing on the same thing. I'm laying on the floor next to my child's bed, and this is not the end of the story.
We did this panel, a similar panel at World Orphan Drug, and people came up and started asking us questions. And I remember some industry folks, pharma companies, coming up and saying, can you talk a little bit more about how you work with the pharma companies? And that struck me as a little bit odd, because I came into the space and thinking, well, of course, why wouldn't we partner with the drug companies. They're the ones making their drug. And then I thought a little bit more about it, and as I started digging a little deeper, I've found that we have this sort of paradigm outside of rare disease, and I hope it's outside of rare disease, that pharma's in it to make money, right? That's their only goal. And if we step back from that and think about it in a different way, who would be a good partner for me? Well, obviously a company that's going to be able to make drug. Do I want them to make money? Of course. I want them to be successful, because if they aren't successful, then my child's not going to get drug, right? So thinking about how can I help them as well. And so I think it's reaching out in those different areas, and especially when I came into Project Alive, it was, and I said, I'm going to speak to every company in our space. And they're like, well, no, you need to pick one and focus on them. And I said, why would we do that? Why would we pick, I'm going to fund this, or I'm going to support this company and this company? I said, we need them all to work. I said, so that's what I'm going to focus on. It's giving this company the most help that they can get, learning about our disease. My son was in a clinical trial. He's still receiving drug, but it was a failed clinical trial. He's been in it for the past 9 years. What can I learn from that? What can I take from that and share with the companies so we don't have another failed clinical trial? So that's a big part driving me. I've done that. I don't want to see it again. So when I'm talking to companies, I'm talking to other partners, I'm thinking that in my head is we need passion, and we don't have time. As a rare disease, and especially for us having a child with a terminal disease, and for those that don't know, MPS II, most of the boys pass in their second decade of life, usually around 15, 16. My son is 13. I don't have time for egos. I don't have time for jockeying for positions. I need to find partners, and I need them to work with me quickly. And Kristin, you talk to industry partners a lot, and what are they asking you about how you can help and how you can bring people together?
Yes, I think, and like you mentioned when we were at World Orphan Drug, there was a few that had came up to me to ask about that. Of, hey, I work with different advocacy groups in this disease space, and how do I do that if they don't necessarily get along? And I had to share, I think we're very fortunate in the Hunter syndrome MPS community as a whole. We have these really wonderful pharmaceutical companies that show up all the time. They're at all of our events, and not just to have their booth and pitch their drug or whatever. They'll come and volunteer for a walk or come help us set up the event, and really having that effort to actually be there and be present, which is really important for our families. I think, as you mentioned too, that there is sort of this false perception, because when you step outside these doors of rare disease, it's big pharma, and so I think that those efforts help our families to break down that wall and to understand that there are people, especially when it comes to pharma's rare disease group, they have that passion that's there as well too, and it's our job to continue to re-inspire them. But I also think when it comes to the patient advocacy organizations, sometimes the issue is just this false idea of scarcity, when that's not really the case. And I think if you're a patient advocate from a pharmaceutical company or have some other role there, it's important to remind those groups of that. If you are someone that might issue grants to patient advocacy organizations that are doing something for the community that you have a drug in or some type of trial, make that known. Make sure that everyone knows that they can apply for a grant. Make sure that everyone is invited to that roundtable discussion. Our pharma companies often meet with us at least yearly to give us some sort of update on what's going to happen, a more formal update. We talk to them all the time, but they make sure that we're all there, we're all invited, everyone has a seat at that table, everyone's getting the same updates, everyone is welcome to apply for event scholarship or sponsorships or other types of grants. So having that is important to almost emulate what you're hoping to achieve, right? And we try to do that just as a patient advocacy organization as well. If my goal is collaboration, then I need to offer spaces for collaboration. I need to be the one to come up with those ideas. Where can we all work together, offering that? We like to always offer groups space at our conferences, whether it's virtual or in person. We like to find areas where we could do events, and it's just free. We can all just participate and be together. And I think that that's really important, and that's something that even a pharmaceutical company can also emulate, that same idea of being the center of that collaboration and treating everyone as equals, that it doesn't really matter how big your organization is, whether it's just it's only you and you volunteer, or you have 50 employees, that all of the people that are sitting there in a room that have a foundation or have that personal experience, they bring something to the table. Their experience matters, and it's important. So we all play a really vital role.
Well, and you mentioned too, the pharma companies actually do come and ask us to come there. It's very intentional. That wasn't the way it was. When we first, for instance, when Project Live was first started, it was very much for our own gene therapy trial. And that was needed at the time because there were no treatments that crossed the blood-brain barrier. So, for a while, that's what we were known as. And again, when I came in, I said, we can't do that. We can't put all our eggs in one basket. Why would we do that, right? Why wouldn't we bring everybody in? And it took a while. We had to have events where we were bringing everyone together in the space and saying, what do you think about that? And an equal voice, as Kristin said, I think that's so important. Whether it's an organization that has $2 million or 10,000 or 100,000, making sure you have that equal. And we did calls for, every month we would have what are you hearing, what are you seeing, and coming together. And it took a long time, actually, 6 months to a year, to get that sort of trust built up. And I think one of the successes now is we have some of those folks that had their own organization on our board now. They're still running their organization, but they're also on our board and advising us. And we never have asked them to just give up your organization, fold your organization, and come work with us. That was never a consideration, right? I always think about these organizations and the fundamental rule of fundraising is people want to give to someone local. They want to impact this child. They don't need to do all the child, but they want to, like you say often, Kristin, your friends want to give to help Charlie, right? And so you need those folks in different places. We had a tremendous fundraiser, and their family was in Florida, and they just plugged in, right? And they had their own organization. I was like, why aren't we partnering with them? I mean, they're doing a tremendous amount of work. We couldn't do that in Florida because we don't have the connections. And so part of that is really just talking to people and being sincere, and it's intentional, right? Because people may think you're trying to take over, you're trying to lead, but you really have to give those opportunities for that. And you may be the person that is perfectly reasonable and everyone else is unreasonable, but you just kind of keep giving those opportunities as well for that to happen. And so bringing it back to Mark, what do you sort of see as some of the stumbling blocks, and how do we sort of overcome those?
So let me ask everyone in the audience, here's audience participation. How many here are volunteers? Okay. See, if you look around, you see from our perspective, I'm a volunteer. We started the Ryan Foundation after getting him off the floor, and I volunteered that day. And now it's 32 years later, I'm still a volunteer. So if you look around the room, if we all have this, we're working for the same cause, the same disorder, the same condition, we're all looking for a treatment. We all look around and we say, well, I know she's got a job, and I know he's got a job. So when Ryan was diagnosed, I was a police officer, and had been a police officer for 7 years. So I retired a few years ago with 32 years in. Never stopped that because I needed the insurance for Ryan. But if you look around at the other tables, if you ask that question, well, why don't you just do this full time? They're going to say, because I've got to have insurance for my my loved one, whether it's a spouse or a sibling or friend or child. So we have something in common. You mentioned it earlier, I think you both did. The biggest stumbling block, why nonprofits can't get along and play well in the same sandbox, is because I want to be the biggest and the bestest. And the only way I can do that is if you're way over there and they only talk about me. Well, what if I talked about you? What if I said positive things about you, about your successes? Would you still dislike me as much? If I went and I got an article in the newspaper, and I talked about the Ryan Foundation, but I also talked about Project Alive. One of the coolest things you said was, you invited other people who have their own nonprofit to sit on your board. Now, what sense does that make? Because they have a different goal. But you know what? No, they don't. Because they have the same goal you do. And we keep saying the same thing and boil it down to what your goal is. And the ego goes away. I don't need to be the biggest and bestest because I want Ryan to live. And that's all I want. And that person going to whether they're working in the fire department or the police department or IBM or wherever, they want their child to live and have a better quality of life. Nothing else matters. Focus on that and all the egos go away.
It is, and one of the things we've done in the MPS larger space, and as I mentioned, the MPS Research and Treatment Center, I just started that job. We're starting that from scratch, not really because the leading researcher in MPS is at UNC Chapel Hill. He's been there for 30 years, and so we're building on that. But part of that, as I feel, as my role as executive director, is making sure that I'm including all of these voices. I mean, Mark has so much more experience with MPS 1. I would never consider myself an expert, but I certainly can learn from him. And that sort of humility of learning from each other and hearing, oh, you talked to the whatever pharma company, what did you hear? Or you're talking to these community members in Florida and California, what are you hearing, right? And getting that together, because as Mark said, you're working towards a similar goal. And one of the really cool things we just did is we had a workshop, and our workshop, and Kristin could talk a little bit more about this, but this workshop that we brought together community members, and we were thinking, we're 3 or 4 people, 5 people, we have 13 people on our board now. What can we do? We need more voices. Right? You always need more advocacy, right? You can never have enough people talking about your rare disease. And so what we wanted to do was bring them together and give them some training, because maybe they hadn't ever had training. Maybe they had a different role that in their company, or they were doing something very different. And so we thought, well, let's just give them time. Let's bring in some professionals. And we got a company to donate their time, and that's what they do. They train people to speak. We went back to our MPS groups, and we said, hey, can you bring a coach? Will you join us? And we're going to co-brand this event and put it out to all of our communities. And it was interesting, one of the organizations, I laid it out, and you remember we were laying it out, and they're like, okay, well, how much do we need to sponsor it? I said, no, we're not coming to you asking for money. All we're asking is for you to join us, and we would love for you to join us. And bring a coach, and bring your experience, right? Mark was a coach, and Kristin, and that was amazing. Kristin, you share a little bit about what that meant for you.
Yeah, it was just a really wonderful experience to really get to work together, and that was the feedback that we got from everybody that participated, where there may be other times where they haven't had that opportunity to work together, especially across our different MPS types. That was the really wonderful thing, was saying, hey, our diseases within the MPS world all look very different in certain ways, but there are so many things that we have in common, and it's really great to bring us all together, because with all of us having these ultra rare diseases, coming together is what gives us some numbers. And I think that many of us know that. That's why we have this conference here, right? To bring us all together, and we're a lot stronger together. And using that within our disease space too, it's just been really beneficial for everyone. And I think the other piece is also recognizing that no one can do it all. There's so much to be done. With Hunter syndrome, we have 3 clinical trials out right now. Growing up with a brother with Hunter syndrome, as a little girl, I dreamed of this day. It feels like a huge accomplishment that there are options available. But we're here and there's still so much work to do. There's still so many gaps in the community, especially because all we could focus on for all these years was just getting to where we are now. There was no room to think about the nuances or living with MPS. What's that look like? What are we lacking? And so there's always room for someone else to come in, identify the gap, and step in, because no one can do it all. There's just no way. And everyone has that different perspective, but that's one piece too, is making sure that we are having a clear mission. And from what I can see, in so many ways in our community, we all have our different kind of niche. This is our particular focus, and there are certain things that Project Alive has not and will likely never get involved in, with supporting the community in certain ways, because there's already groups that do it so well. And so when community members reach out to me, I think, Mark, you mentioned that, when they reach out and they say, hey, I'm struggling to get durable medical equipment, I say, hey, this is the organization, you call for that. They're gonna be great, they're gonna help you through that. Why do we need to recreate the wheel there? If anything, I'd rather support you in that space. There's larger groups than us. I mean, you've probably all have heard of Every Life Foundation. They lead the way in advocacy efforts. So why would we recreate the wheel when we could just join their efforts and again get stronger in numbers? So there's been a lot of areas. That event was wonderful for our particular community, but we often see each other, especially when it comes to advocacy work. We have to. You will not get anywhere if you refuse to come together when you're trying to march on Capitol Hill. I mean, the more of us that there are, the better it will be. So we see each other at those committee calls for advocacy work, other conferences. And so there's areas where you're kind of running into each other. But as Kim mentioned, there's ways to make that more intentional and to really make it clear, hey, I want to do these things with you. I want to join forces and support our community as a whole, because I think that's kind of the key takeaway here, is we all really have the same goal, and we're really brothers and sisters in all of this. And I think sometimes that can get lost, but I hope to always have the humility to always be able to remember that, to go to sleep at night knowing that that was what I thought of, that I have that same goal. It never goes away. And again, the humility piece, looking at people who have been around longer, who have more experience than me. And I'm pretty new here. I'm a younger executive director, so that's something I do all the time. I want all the mentors I can possibly get and learn all the things that they have found success in, or where did things go wrong? What have you tried that I think's a great idea, but you've gone down that road and it's just too much? Tell me all that information. I don't ever want to cut myself off from that learning opportunity. So, but yeah, that event was really wonderful, and I hope that we can continue to find other ways to bring us all together, and it's something I would definitely encourage any other patient advocacy group.
I would add one thing to that.
Yes.
Is as you look for mentors who've been in the space for a long time, Kristin and I chat quite a bit. You may not want to refer to your mentor as grandpa, but it's endearing.
Well, how do you mentor her?
We banter and we have conversation. We find our like goals and we bounce ideas off each other, because just because I am your grandfather doesn't mean I know everything. There are many things, ideas that you come up with in the MPS space that other disorders. I spoke in Chicago a few years back to Niemann-Pick. There are a lot of organizations in Niemann-Pick, and there is some traction in Niemann-Pick, and there are different opportunities for treatment in Niemann-Pick. There are also a lot of arguments and discussions. And here's the reality: humans, and this is not to do with Niemann-Pick, but I'm talking about humans. Humans are obstinate and stubborn, and if you question that, you just ask my mom. She absolutely would agree. Because of that, we want to be right all the time. We're not, any of us, right all the time. Kristin and Kim both taught me an immense amount of things, not just about MPS 2, but about conversations with industry. How many people here have an industry partner in your disorder? So maybe 25%. Just remember, a long time ago, the answer to me was, they will never come because there is no business model. The numbers of MPS 1 born in the US have not changed, not from 1991 to 2023. And yet, for MPS 1, I count 9 different companies vying for opportunity to treat, some in the pipeline. Now, how did that happen? It happened because of your voice. And if you have to believe that this day, this moment, you have the opportunity to change the reality that there is no pharma company ever coming to your space. And even if you're an N of 1, that's never going to happen. Well, talk to Stephen Gray at UT Southwestern. He does N of 1 trials. Why is he doing that? Because there's opportunity to treat. You have to believe if you find the partners, whether they're in pharma or in academia or sitting next to you, that partner can help you and you can help that partner move forward towards what you want is a treatment.
Yeah, and I wouldn't want anyone to walk away thinking that we all live in a world of candy canes, unicorns, and those chocolate. That would be good. Because we don't. I mean, this is every day I think about this, and especially when I came into this role of executive director of a MPS center that had never existed before. And you know, I always feel this sort of tremendous pressure. I'm building this, right? And I have to check myself, and I do it every day. You know, something will come up, and I'm angry, I'm upset about it, and I have to say to myself, Kim, because I call myself Kim. I say, is that your ego? What's really behind this, right? And it has to be intentional. And it has to be, I want to see, why am I arguing with this person? Why don't I like them? Why are they? And a lot of the time, you know, when I do come across and I say, I just don't get along with this person. And part of that is because I don't know that they're focused on their mission. You know, they may think that they are focused on getting glory or speaking at this event or being recognized with an award or whatever it may be. And so then I have to think, well, how can I work with this person? Because we don't see eye to eye, right? What can we agree on? And some of the time it's, I don't really like you, but I want to bring you in. I need you to help. I need as many people to save children's lives. And so how do I get along? And again, it's very, very intentional, right? And in a normal world where we weren't all involved with rare disease and there were, you know, 500,000 people or 2 million people, we could just say, you know, I just don't like that person. I don't like that group. I'm going to walk away and find another group. We can't do that, right? We're so small that we need to be partnering with folks. And I really hope you walk away with that thinking, I have to do that. I'm the one that's going to make the change. I'm going to do it. Because, you know, sometimes people are like looking around for who's going to do it. And I do this a lot. I'm from Tennessee, so I'm a natural volunteer. And I actually have to tell myself to count to 3 or I'll volunteer for everything. But, you know, if you're waiting around for somebody else to do it, why not you? Why aren't you the bridge builder? And I think you have to ask yourself that. And maybe it is your own ego. Maybe it's not. I don't think it is, or you wouldn't be in this session, right? But working with those folks, I think that's another sort of thing. And Mark, you've worked with a lot because you've been doing advocacy for so long, and you were chair of Every Life. And how did you sort of deal with folks that may not be focused on the mission and might be? How do you work with those folks?
First, I had to learn that there are so many other people on the same journey as I am, and that their journey is just as important, is just as urgent as mine. And how do you deal with someone, like you mentioned earlier, who is stubborn and obstinate? You talk with them and not about them.
Yeah.
You have the courage to put your own ego aside and realize, I know a lot, but realistically, I don't know everything. Absolutely, I don't know everything. And they know something I don't know. The most important thing about changing someone's perspective is to change their perspective about you. And how do you do that? By talking about them when they're not in the room. I've done that. It doesn't work. because it always comes back, and then you just feel horrible. So the reality of it is just like in trying to find the answer for your disorder, your condition, you have to challenge it. So challenge yourself to be the change maker, to realize that change can come if I change myself first. That's been said forever, but it doesn't work unless you try. So first and foremost, respect the person you're speaking with, because they've been laying on the floor next to a bed just as you are. Respect that point and remember it as it is a fact. And then move forward from there. I'm not right all the time. They're not either. We can find common ground. We should try.
Yeah. I'm going to open it up for questions. Is that okay?
Yeah, great.
Hope we have some. Don't be shy. All right. Well, do we have one? Okay.
Hi, I'm Melissa, and I'm with the Pura Syndrome Foundation. We're much smaller than you guys. We have about 700 known worldwide right now. And we've just recently had another group break off because most of our research is done through universities in the UK, and they wanted more control over the research, which over there is not even looking into therapeutics or anything. So I'm great with it, but my question is, why not merge? I can see why they didn't want to, because they're, I can probably figure out what, why they wanted to control the large donor list that they've gotten so far. But would you, and talk to somebody else earlier today about maybe possibly merging both foundations? Is that a good idea, or just do what you guys are talking about?
Looking at me. I think I would ask, why merge? Why do you need that? Is that someone else feeling like they need to be the one in control, and so they're trying to bring others in? I mentioned we didn't try to do that. We reached out to the other organization as equal partners. And again, if you're in a rare disease and this organization is supporting this research in the UK, you want that to be a success, right? Right? So is there an opportunity there for you to say, how can we help with that? How can we partner with you on that? There's also going to be some research that you're going to look at and say, I think that's a little iffy, and I don't want to support that. And that's perfectly fine too. But I think if you're saying, why don't we merge, which was where I started with, and then I thought about it, but why do we need to merge? Right, and everybody can still work and add their talents, but you want to add to that?
Yeah, that's a common question, and because it happens all the time. I think the key word is control. If I raise the money, and Kristin mentioned that as well, if I raise the money, I want to control where it goes, and that's normal. In olden times, there were national organizations for even small groups, and anyone who broke away from the national organization with the onset of the internet, where mom and dad could start their own nonprofit and start marketing, those organizations were called splinter groups. And as probably the first splinter group, it was just so discouraging, and it made me mad. I'm not a splinter group. I'm here to save our children. We all are. So one thing to remember about groups that break off is, I've always read since the very beginning of the journey about gene therapy, and gene therapy is going to be our answer. It's a one-time fix, and it might cost $2 million. But if you do the math, that's fine because it's a one-time fix. But the reality of it is, now that with more science is coming forward, it doesn't fix everything. So what does fix everything? This, and then some of this, and some of this. So there may be 3 or 4 treatments. And how do you fund those? One at a time? Well, congratulations, you spent 75 years. And that's way too long. So maybe a splinter group or a break-off group funds this in the UK, and something here at UCLA, and something here at Stanford, and something over there in Japan. And all these groups then actually have therapies that might or might not work. And when one finds out it doesn't work, you know who wins? Everybody else, because then we can go somewhere else. So in my estimation, it's okay to have break-offs, as long as the goal is not control, the goal is to treat.
Yeah, I think so. Kristin?
Absolutely, with everything that you all said, I think I think someone else has a question, so I'll go ahead.
Oh, do they? I didn't see that. Okay.
I don't really have a question, I just have a comment to just say, and I am in the MPS disease space in San Filippo, and I did form a new foundation. Early on, I had the same experience that Mark had with the national organization, And I wouldn't suggest it again if I were to have a do-over, as my son used to like to say. When he would mini golf, he'd get a hole in the one, and he didn't like that because he liked to hit the ball, so he always wanted to have a do-over. More hits were better. But I would also say this, that there is an effectiveness of inviting the splinter organization, if that's what we're going to call it, to the table, and that's the tool, right? And so maintaining the conversation, and there were 12 splinter organizations in San Filippo that came together. They were worldwide and functioning separately, and we did some pretty incredible things together, including driving therapy into the clinic. And we did other things that were also incredible. So don't just look within your own disease. Look to your neighbor who's doing something similar. So an example was there was a competition that Pepsi was running called the Pepsi Refresh, and you had to get a lot of votes. So we didn't just look into our own disease community. We went to the SMA community and said, okay, we're going to form an opportunity for people to vote for us. Can you ask your people to vote for us when they're also voting for you? And then we went to the next nonprofit that was also enrolled in it, and we said, can we partner? And we all pretty much achieved the goal of receiving, it was a $250,000 grant, and this was 10 years ago, so this was, or maybe even more, because I'm a long hauler in rare disease. But I'm also saying is, listen to what Mark and Kim and the team up there are saying to you, and invite those people to be at the table with you. And think not with your ego, but with your heart. Mm-hmm. And your heart will help you figure out how to get along better. And then look to the organizations that are sitting next to you that may not be in your disease space that you can live and learn from, and maybe partner on exceptional opportunities. So,
Can I add one thing to that? I want you to, it's a question for you. And this is the coolest part about that story. 12 splinter groups got together and formed one group. And what did you call it? Team?
No.
Wasn't Team San Filippo?
No, that was a whole different splinter group. They were one of the splinter groups.
So we'd like to thank you for coming in today.
No, we just all got together. We funded the research together. We didn't put all our eggs in one basket, by the way. Each of us were still already funding some other research, but we took one project and we sort of pushed it through together worldwide, but we didn't have a group name.
You don't need it.
We didn't need it. We wanted our individual identities, and I think too, inviting those people to be at the table is really the message that you really need to. I formed my splinter group initially because I wanted to be at the table and I wasn't invited.
Yeah.
And that's really where you have to start. So keep at it.